You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about early detection with breast cancer and screening, what you need to know about thermography, mammography, things like that. My first guest has strong opinions about what you need to do. We have Dr. Christine Horner. Dr. Horner, welcome to the program.
Thank you. It's my pleasure to be here.
Now, for people that don't know, you've read a great book. You were involved in getting, I guess, breast reconstruction covered by insurance.
Correct.
And you're a board certified general surgeon, board certified plastic surgeon, and you quit your practice, and now you pretty much spend all of your time on educating people about breast cancer detection,
prevention.
And prevention.
Yes.
Okay.
Yes.
So tell me about that. I mean, how did you get so wrapped up in this? You quit your plastic surgery practice, and you can tell the story.
In my practice, I was doing a lot of breast reconstructive surgery, and my patients were getting younger and younger and younger, and finally I was doing women in their 20s. And I thought, you know, something is way wrong here. So I went through the medical research, and this is a long time ago, before we knew anything, and I didn't know what I was going to find, and I instantly found thousands of studies that show exactly why we have a breast cancer epidemic and prostate cancer and, you know, ill health in general, all the things that we're doing to contribute to it, and the things that we traditionally don't do in this culture that are highly protective, and they were all natural. So food, supplements, herbs, lifestyle, all the things I was taught in my medical training didn't make a difference.
Okay.
They lied to me.
Have you seen people, by the way, that you've helped?
Oh my goodness, yes. I mean, I take care of lots of different patients, and also now I'm doing consultations nationwide for people, telephone consultations, to help them through the process if they're diagnosed with breast cancer.
Interesting. Okay, so let's talk about imaging and screening.
Sure.
What women need to know.
Well, you know, we have been indoctrinated to get mammograms done, right? And so there was a recent study that came out that showed, and very well designed study that showed that mammograms don't help save lives. Very controversial.
You agree with that study?
You know what? I actually do, because knowing about how mammograms work and all the problems in them, it really is this toss-up about whether they're beneficial or they're not. In my estimation, there's other things that you can do that are much better. So mammograms use radiation. Well, guess what? Radiation causes breast cancer. So, like, why would you do a test to look for a disease that it causes? And it's accumulative. So doing it at early ages, I mean, here's horrifying statistics. So people who have the BRCA1 gene mutation, which is what Angelina Jolie had. So it gives you a predisposition for a much higher incidence of breast cancer. And people then start checking these families, the women in the families at much younger ages, but their breast tissue is far more sensitive to radiation. So if you do any kind of radiological examination on a woman with a BRCA1 gene mutation before age 30, her risk of breast cancer goes up by 90%.
Wow.
Right.
Interesting.
Now, mammograms also miss a lot of tumors.
But women aren't even getting mammograms till they're 40. Isn't that correct?
Well,
I mean,
not necessarily.
Is that when they're told to do it?
Now, the age, they keep saying later and later and later. And why? Because they're not showing any benefits from it. It can't see through dense breasts. It misses 20 to 30% of all breast cancers, because breast cancer has to have calcium in it for a mammogram to see. Well, if you miss that tumor, I mean, I've had patients where their entire breast was filled with tumor and it didn't show up on a mammogram.
Interesting.
So women are falsely given this sense of security that they're okay, and it can lead to delayed diagnosis.
So what is the answer, though?
So we have many other screening tools that you can use. Now, the important thing is none of them are perfect. So what the research shows is that you need to do multiple different screening tools in order to get the best, what we call sensitivity, meaning it's finding something if there's something wrong, and the best specificity, meaning if it finds something wrong, it actually is.
At what age should a woman?
Well, here's the deal. You can actually start in your 20s, because I told you I was doing breast reconstruction on women in their 20s. So you can use various different techniques that do not use harmful radiation. And so there's ultrasounds and a variety of different sophisticated ultrasounds that give us very detailed information. That's a physical exam. And then you can do thermography, which is simply an infrared picture of the breast, and it shows us the physiology of the breast. So we're seeing the physiology of the breast, the anatomy of the breast, and combining those two together.
So you like those two tests?
I love them, yes. And that's what I highly recommend. And they can be done safely on any age.
I mean, even though there's no doubt about it that there will be people that are watching this, and I've met people, because I've interviewed a mammographer before,
Mm-hmm.
who believes in what you're saying now. I mean, this was 15 years ago. But some people that, because of the mammogram, it got their stage 1 cancer, and they were able to take care of it right away.
Right.
But that's not the majority of people. Is that correct?
Well, most people find it through physical exam,
Okay.
but the mammograms are overdiagnosing too. So when they find something and they
Oh,
say,
interesting.
"Oh, this is suspicious. You need to have a breast biopsy done." In the United States, over 1 million breast biopsies are done a year, and 800,000 of them are unnecessary. It's wrong 80% of the time.
So, is a licensed medical doctor here in California, I guess they have to recommend mammograms to their patients. Is that true?
Pretty much,
Pretty much, or yes?
Pretty much, that's how it goes. This is a real problem in our medical system where there's things, the way that things have always been done, and then they put blinders up to see, what the medical research
Will insurance
shows.
cover these, the ultrasound and the thermography?
They will cover the ultrasound. They do not cover thermography, so that's out of pocket
And thermography
expense.
is only about a couple $100, $350, something
No,
like
less
that?
than that, yeah.
Okay.
Yes.
So do that. And what kind of a doctor do they see that offers these kind of things?
Well, looking for an integrative doctor, which there's more and more of them around, where they're doing a combination of Western medicine as well as complementary and alternative medicine, is one that I always recommend, because then you're with somebody who's really open-minded and looking for what works, not what's put in some false category.
How many mammograms now you live in San Diego, how many mammograms are happening every day, let's just say in California?
I mean,
Thousands, hundreds of thousands?
Of course, right.
And every one of them should be stopped, in your opinion?
Well, here's the deal. That's another horrifying that concept that women don't know, is that they say, oh, there's not that much radiation in a mammogram. But actually, it's estimated that one mammogram has so much concentrated radiation to the breast, it's the equivalent of 40 chest x-rays.
Is that right?
And when women find that out, they're like, oh my God, I don't want to have that
But only
happen.
in younger women, the studies say.
No,
Okay.
So it's an accumulative exposure too. So every time that you have any kind of radiological examination, that radiation accumulates.
So if it were up to you, of the 100,000 plus mammograms done every single day, you say that if it was up to you, they'd be stopped.
Pretty much. I think there's
Pretty much, or
very
yes?
little, I mean, there's no question that mammograms have saved lives, but I think that there's better exams out there. The research shows that if you do a combination of these more sophisticated ultrasounds with thermography and with physical exam, you get better results than what you do with the mammogram.
So a woman watching this,
Yes.
breast cancer may run in their family. They took the test, they have that gene.
Yes.
They should get ultrasound, thermography,
Thermography,
and of course self-exam.
And
Or a doctor, a professional
correct.
examining their breast.
And also, their focus should be much more on the things that they can do to prevent it in the first place.
Which is what you've talked about. And could you rattle those off?
Sure. So, it's diet and lifestyle, basically, in certain key supplements. So, eating primarily a plant-based diet, getting exercise, even brisk walking, has been shown to statistically improve statistics, tremendously. Going to bed by 10 o'clock has huge statistical data, too, because it helps with our hormonal fluctuations throughout the day and throughout the night. Managing stress, so doing an effective stress reducing technique, which could be yoga, breathing, meditation, and then also relationships, we talked about too, which is that of all the things that affect our health, feeling loved and supported is the most influential, and being in toxic relationships is the most damaging, more than smoking and more than genetics.
So somebody with breast cancer, and they're in a toxic relationship,
Yes.
that's going to weaken their immune system?
You bet. In fact, we find a correlation in the studies when we look at psychological parameters in women who get breast cancer. One of the commonalities is they're having relationship problems.
Interesting. All right, so stay away from anything that suppresses your immune system.
Ideally.
Like processed food.
Sugar's just slugs your immune system.
So with you, I mean, you have we talked a little bit of wild salmon,
Right.
the cleanest
That's the
salmon you
cleanest
could
fish.
get, and mostly plant-based.
Yes, mostly
And you
plant-based.
love turmeric.
Yeah, so some key nutritional supplements, the ones that are the most potent: turmeric, green tea, flax seeds that you grind in a grinder, and you take about 3 tablespoons a day, omega-3 fatty acids, vitamin D, and a mushroom formula called AHCC, which research shows through hundreds of studies that AHCC supports every cell type in our immune system.
And this is all in your book?
It is.
Okay, do you have a blog? I mean, if somebody wants to go to your website, you're going to keep them up to date on all the new breakthroughs,
I
cutting edge
absolutely
information?
am. I have a newsletter they can sign up for, and I send that out and give them. I have a video blog and also some written articles that I send out on a regular basis.
Okay, and I want to have you back on my show because I have a lot of questions, very interesting, or at least to me, and I know it's a lot of people, that if they have that gene, what's it called again?
The BRCA1
that Angelina
gene.
Jolie had, should they get a mastectomy, and does it improve their chances?
Yes.
So we'll have you back to talk about
Okay,
those.
I
'Cause
love
I'm dying to
that.
hear your opinion. You have strong opinions
I
about
have
that?
very strong opinions
Okay,
about
good.
everything.
All right, thanks so much. You've been watching The Wellness Hour. We'll be right back. I'm Randy Alvarez.